So I've opened up everything that I've explained now that we use for the fine needle aspiration biopsy technique. I'm going to use this chicken in cling film model to use as a tissue model to show you how we do the biopsies. And okay, let's start. So first of all, I've opened the pack. You need to put in some cleaning solution, clean the patient's skin as you usually do when you're going to perform procedures. Ideally, before you even start this procedure, make sure that you have explained to your patient exactly what you're going to do, how you're going to do them. Explain to them that it's not really a very painful procedure, put their fears at ease. Make sure that you've got signed consent or that the patient at least gives you a consent to perform the procedure. Once all of the paperwork is done, then make sure that your tray is set up to perform the procedure. So what I'm going to do is, first of all, whether you're going to use local anesthetic, you can draw up your local anesthetic. To do that, so get a little bit of local anesthetic. If you're going to use it, inject some local anesthetic into the area that you are going to biopsy. What I usually tell my trainees is it's a good thing to remember that if you are going to biopsy a large lump or a tumor, the tumor itself is usually it's insensate. There's no nerve tissue in there that can cause any pain. The thing that usually causes the pain is when you penetrate the skin in the subcutaneous tissue. There's actually not a lot of pain going through subcutaneous tissue, and injecting local anesthetic into that area, sometimes just the distension from the local anesthetic actually causes a lot more pain than doing the biopsy. So, again, I've said it before, but I'll just reiterate it. Use your clinical judgment to decide whether you're going to do that or not. So what we do is, I'm going to connect the black needle onto my syringe. You are going to use palpation to feel where your lump is that you're going to biopsy. You usually come in from the side, go into your lump. Once you are into your lump, put some aspiration on your syringe, and then what is quite important, you need to move in and out quite quickly in the same plane to agitate tissue and suck it up into your needle. You can then change direction and do the same thing again, or change direction and do the same thing again in a different direction. If you go in different directions, or you can do it once, come out of the patient, disconnect the needle, put what you've aspirated onto your specimen slide. To make your smears, there's different techniques. The one that I prefer is more of a crush technique. One needs to be careful not to crush the cells, distort it, and make it very difficult for the cytologist to see what's going on. So I would just lightly put the two slides onto each other, create a little smear of the tissue, and then remove the two slides. Okay, so once your tissue is on the slide and you've made your smear, one can have a look at the slide, and you can usually see if there is tissue on the slide or whether it's just blood. If it's just blood, I would suggest that you repeat your biopsy, but usually you can see the small little tissue pieces that is there. If you don't see those tissue pieces, you've probably done an inadequate biopsy and you need to repeat it. Once you are happy with your biopsy, one needs to fix the slide. Use your cytological fixative. Hold it a couple of centimeters away. I would say at least 30 to 40 centimeters away from the slide, and just give it a light spray, and that is all that's necessary. You can put it to side then to dry before you put it into your carrier, and it goes off to the lab. So there are different modifications of these techniques. If you are going to biopsy a very vascular area, like the thyroid gland, for example, what I do is I would do two biopsies. First biopsy would be without aspiration. That gives you a lot less cells, and also a lot less blood. Whereas if you do an aspiration biopsy on a thyroid, you're going to get more cells, but you're going to get a lot of blood that can make diagnosis quite difficult. So the technique without using the aspiration is pretty much exactly the same. You feel where your lesion is, you go with the needle into the lesion and then short stabbing movements in the same direction, and what is sometimes needed with this is to sort of just roll the needle while you're doing that, just to use the cutting edge of the needle to loosen tissue a little bit more. Then you can take it out, attach it to your needle, and then spray it on your slides, make a smear, and then fix your specimens as I've described earlier on. So those are the two techniques that we used to get a good fine needle aspiration biopsy. One with aspiration, and the other one for areas where there's a lot more blood, where you can try the technique without the aspiration.